What happened exactly with the Spartan Cube test? How come it was 3 weeks ago good to go, and now it's not?
Yes, so I think it was April the 11th when Health Canada authorized Spartan, the test kit, under an interim order pathway. So this is part of the acceleration of access to innovative testing. But built into that process is actually clinical validation of the device and its system. So it was actually the National Microbiology Laboratory from the Public Health Agency who collaborated with clinical sites in 3 provinces to actually use this device and system to take samples from actual patients. And so while the Spartan system or the device performed very well in a laboratory setting and along the specifications that the manufacturer had provided, it was in the real life setting, in the clinical setting, where it didn't perform well. And right now, it appears that it may be related to the proprietary swab that goes with the system. So I think what Health Canada is doing is to amend the authorized intended use for research use only, so that more clinical validation can be done once the manufacturer adjusts its system. So I actually think this is a really, it really highlights the importance of the kind of quality assurance that we're putting to our new tests, and that really there's been no use of this test kit in a way that would have impacted patient diagnostic outcomes, because you're doing this in the context of an actual clinical trial evaluation.
On Friday, you were saying that we were testing about 23,000 a day. You were hoping for almost 3 times as much, 60,000. How does this Spartan Cube setback impact this objective?
It actually doesn't impact it, because the provincial-territorial target collectively of the 60,000 is just on the existing PCR tests within the public health laboratories. And then we would add on top of that any point of care testing that comes on board, some of which are already in use, such as the Gene Expert. That is, for example, also being used in Nunavut, for example. So some of the point of care is in addition to that initial provincial-territorial capacity target of 60,000. And I do know that, the provinces are ramping up the testing, and we'll see what happens in the next 7 days as they ramp up some more. I know that in the last 24 hours, we actually did over 31,000 tests. So we still, even within that scope, got another halfway to go. If you think about, we're doing 30,000 a day, say, since yesterday, there's still room for them to continue to ramp up the testing approaches. And so then the point of care, actually, the key adjustments and plans will be for, I think, the rural and remote communities. So the concept of using these more near-patient tests is so that we can render these communities more independent of transportation. So any kind of delays might, in fact, impact on the fact that we need to continue to transport specimens, for example, that would have been dealt with earlier. But we are looking at other supplies of the point of care. So this isn't the only one. So I think it's, again, a dynamic process.
I think it is important not to refer to what is happening with the Spartan test kits as a recall. This is part of the process of Spartan ramping up to have tests to be utilized. And we were not expecting that they would be ready at this moment in any case. So in my view, the issues that you're highlighting aren't a recall, aren't defective product at all. The public health lab has said that they will be used in research settings, and Spartan will continue to produce and review and revise the technology that it is producing for the rapid test kits. And then as the testing warrants, they will be able to be used across the country. But again, this is part of the process of producing new technology, of producing something that is going to be very important, but is just getting retooled and ramped up at the current time.